Assalamualaikum everyone. Our group consists of Akmal, Hanani, Emilia and Hamiza will present about forearm crutches. What is the function of crutches? It is used to help people who have injuries at their legs that affect the mobility. They can be used short-term, during the healing process or long-term for a lifelong handicap. There are three primary types of crutches, which is underarm crutches, forearm crutches and forearm support crutches. But in this video, we will go through the details of the forearm crutches. Forearm crutches is also known as loaf strength or elbow crutches. It is often used as a long-term mobility aid for people with a leg disability. It is also required the most upper body strength than underarm crutches. The contact indication for these crutches is commonly age, as the eldest and the youngest may not have enough strength and coordination. Other than that, any coordination and balance disorders or musculoskeletal injuries may hinder the user to support on the crutches. So here on the right side of the slide, there is a picture of forearm crutches. The top part is called as forearm cuff. Below it is a cuff adjustment area which has same function as the adjustment area where we adjust the height of crutches. Between those areas, there is a hand grip for the patient to grip and support, and at the bottom is a crutch tip. Next, we will show how to measure the forearm crutches. To measure the height of the forearm crutches, patients must stand tall with the shoes on. Ask the patient to relax his shoulders with his arms hang loosely at his sides and make sure the hand grip is at the same level of the wrist. Then the therapist should adjust the height according to the patient's suitability by lengthening or shortening the adjustment area. Once adjusted, the forearm cuff should be about 2 to 3 fingers below the elbow, and patients should be allowed to have 15 to 30 degrees of elbow flexion. After measure the height, therapist should adjust the same to the other crutch.
Do and don'ts. Patients are reminded to avoid this movement or action in order to secure their safety and maximize the usage of the elbow crutches. Patients are not supposed to put their elbow crutches in narrow and wider position, as the base of support will become smaller and the patient might fall and lose its control due to insufficient balance and the coordination of the body. Generally, this is how the patient standing from the sitting position by using elbow crutches. The position of the elbow crutches is at the weak side of the leg. Also, weak leg appear to move forward compared to the strong leg. Patient must keep his hand at the side of the chair and push downward to give it some momentum to standing. After that, the patient are able to stand and grab the elbow crutches to standing and to control it so the patient can stay in the balanced position. For the second cases is the patient with paraplegic condition. The position of the elbow crutches is in the front of the patient as the therapist is standing at the side of the patient. Patient will using their hands to push the hand grip of the elbow crutches for giving it some momentum to standing, and the patient will hold the elbow crutches to maintain its standing position. Patient will using their hands to push the hand grip of the elbow crutches for giving it some momentum to standing, and the patient will hold the elbow crutches to maintain its standing position. A person with paraplegic condition may have limited mobility and sensation in the legs. However, therapists should always be aware to monitor the patient for any possible incident that might be happen when the patient using the elbow crutches.
The definition of two-point cat is the weaker leg moves forward with the opposite crutch followed by the stronger leg. In two-point cat, only one crutch will be used and the crutch will be at the strong side. In this case, the affected leg is the left side, so the left leg will move forward with the right crutch first and then be followed by the right stronger leg. The position of the therapist is on the left side of the patient, which is the weak side. For two-point cat, it is usually only used with partial weight bearing, which the weaker leg will be touching on the ground firmly without strong pressure, which in this case is the left leg. Three-point cat is a gait in which the weaker leg moves forward with both of the crutches. There are two types of three-point gait, which are three-point gait with partial weight bearing and three-point gait with non-weight bearing. Three-point gait with partial weight bearing is where the weaker leg will be touching the ground firmly without strong pressure, while three-point gait with non-weight bearing is where the weaker leg will be hanging and never touches the ground. Three-point gait can be done by swinging to or swinging through the crutches. This is three-point gait with partial weight bearing swinging to the crutches. Both crutches along with the weaker leg move forward first, then followed by the stronger leg swinging towards the crutches. This is three-point gait with partial weight bearing swinging through the crutches. Both crutches along with the weaker leg move forward first, then followed by the stronger leg swinging passing the crutches. This is 3-point gait with non-weight bearing swinging to the crutches. Both crutches with the hanging weaker leg move forward first, then followed by the stronger leg swinging towards the crutches. This is 3-point gait with non-weight bearing swinging through the crutches. Both crutches with the hanging weaker leg move forward first, then followed by the stronger leg swinging passing the crutches.
Next, for 4-point gait, this is the most commonly used to provide assistance with walking when both legs are in weakness, poor balance, and poor coordination. This gait type is also very frequently used with platform crutches. For forearm crutches, there are 3 ways to walk using 4-point gait. Okay, first, generalized weakness. We start with put the right crutch out and step with the left foot. Then put the left crutch out and step with the right foot. The pattern called right crutch, left foot, and left crutch, right foot. For the precaution, therapist should stand by near the patient to support him if he is about to fall. Okay, second, paraplegic swing to gait. We totally depend on the forearm crutches to support weight bearing both feet. This gait is lower but has smaller risk of falling. We start with put the both crutches out, then swing forward both feet next to crutches. Since this is the less stable position, the patient needs to quickly reposition the crutches anteriorly after completing a step and resume in a balanced standing position. It continues until patient stops, while therapist should not stay away from the patient. Third, paraplegic swing through gait. To perform this gait, which is faster but requires more energy and has a higher risk to fall, patient will start with put the both crutches out, then swing forward both feet in front of crutches.
Now, we'll move on to techniques of climbing up and down stairs. This video shows technique of climbing upstairs for non-weight bearing. Crutch must be at the weak side. Good side always go up first, followed by weak side and crutch. Therapist should be standby behind the patients to support them. Next, technique of climbing downstairs. Crutch must be at the weak side. The weak side together with crutch must always go down first, followed by the good side. Therapist should be standby near the patient to make sure that the patient won't fall forward. It can be observed that in this video, the patient with partial weight bearing is climbing upstairs. The technique is the same as non-weight bearing. The difference is that patients with partial weight bearing can bear a portion of their body weight on their affected lower limb, while non-weight bearing cannot. Last but not least, it can be seen that the patient with partial weight bearing is climbing downstairs. The technique is also the same as non-weight bearing. In conclusion, there are 5 types of gait, which are 2-point gait, 3-point gait, 4-point gait, swing to gait, and swing through gait. When using forearm crutches, there are a few safety measurements that patients should follow. The crutches should not too narrow or not too wide. Do not twist the body or crutches, and the crutches must not too far from the body. Thank you for watching.